Singapore, as you can see. Today is an exciting day because I am actually getting my suture method double eyelid surgery today with Ishan Go at Eagle Eye Center. So this is my before, and then I'll give you kind of a rundown of how everything looks and how the procedure will go. Kind of nervous, but should be okay. I'm in good hands, I think. So currently 1 p.m. and I am about to go for my non-incisional double eyelid surgery, and it's at 2 p.m. So I need to be at the hospital at the clinic, hospital, whatever, at 1:30. So I'm about to call a grab and head over there. And this is right before I leave home, and you can kind of see that I have them when I force them to come out, but I want them to stick, you know what I mean? So this is before, and then I'm gonna have a little consultation and see what the doctor thinks is best for me, and then after that I'm gonna head right for the procedure. And stay tuned, I'll keep you posted.
Okay, so we talked about the options of what we're gonna do, and I think we decided that I think in your instance, the combination of requirements based on healing time, your cosmetic outcomes that you desired, that maybe a suture blepharoplasty might be a more appropriate procedure. So how the procedure is done is that we give you a little bit of local anesthesia and a little bit of medications to keep you comfortable. And then what we will do is that we will use one long continuous suture, and we use that suture to crimp or to press the tissues in the upper lid so that it forms a fulcrum, so that when the eyelid, when you open your eyelids, the upper lid will fold at that point, and at that point where the fold is where the double eyelid is formed. So the idea being that if you have your desired eyelid height, here for example, we would compress the tissues here, tie it off down here, so these tissues get compressed, and this, looking from straight ahead, this can form the eyelid height at your desired eyelid position. Okay, so how we actually do it, you may not have felt very much, but we will make 3 separate stab incisions, 1, 2, 3, and then we'll feed the suture in through one side and another side down here. Alright, we'll go through the eyelid, come back out this side, similarly on this side, come inside and come out. Then we'll have 2 ends of the suture, which will come out here, and then the 2 long ends will be here, and then we'll tie that together. So I use a specific technique called a durable suture technique, a specific modification of that, where we take this 2 ends of the suture and we tie it across each other 7 times, or I prefer 5, but 7's the number of perfection, so why not 7? And then you may remember that halfway through we asked you to open your eyelid and just kind of check the height. So the other thing we need to make sure is right is also the tension as well. So you don't want to, it's a little bit like the Goldilocks story. You want it to be kind of just right, neither too loose or too tight, because if it's too tight, then the shape and then the crease on the skin would also look unnatural as well. So once we're happy with that, we just tie it off and we bury the sutures inside there. And so that's why hopefully you won't be able to see any knots or any sutures. And we try to aim for a very that stab incision that we made in the skin that should heal up really quickly over the next couple of days. And maybe by next weekend, next week early, you can even start your normal exercise routine. Certainly, I think by Monday or Tuesday, you can wash your face and wash your hair as per normal.
Okay.
But maybe for the next 2 or 3 days, just take a little bit of care not to be rubbing the eyelids too hard.
Oh, wet. No wet.
Try to keep it dry.
Yeah.
So even if it gets wet, don't panic. Just take your clean tissue or gauze, just dry it, and then that ointment that we gave you, just apply it to the skin. And you should be good. Okay. So when's a good time for us to see you? Can I see you next week? Maybe Monday?
I feel good. More bleeding on the right side. We are 20 minutes post-op and I'm feeling just a bit tight, but no pain. It's just a little bit blurry because of the eye drops, but I feel okay other than that. So I'm gonna take a car back home and then update you from there. This is right after I got home from it. You can see my eyes a little bit droopy from the anti-inflammatory injection. You can see the threading and stuff like that, but I'm so happy with the way it turned out. Like, as long as this starts to not droop anymore. Very cool, very natural. 4 hours post surgery. We are at hour number 4, 5. a little bit better. This one is definitely drooping more than this one because of the steroid jab. So I'm hoping by tomorrow morning I have some balance. Wow, this. Here's my update. It's 11 p.m. right now. I had the surgery done at 2, maybe 2:30. So it's been about 9 hours. And this is night number 1. This eye is significantly more swollen than this eye. Still both a bit swollen, but when I look at screens or like bright lights, it's really kind of like blurry. I'm gonna put a cold compress before I sleep, and then hopefully I'm able to sleep like upward so it doesn't affect anything over here. But that's the update. Okay, it's day 2. Still looking a little bit swollen, and I just put the ointment on my lids and in my eyes, and it's making everything really blurry. But I'm going to a laser appointment right now. Today we are at day 3. And it's looking a little bit more even, and this swelling of this one has gone down a bit. So I'm just gonna continue taking my anti-inflammatory and doing the little ointment, which is this, and then hopefully it doesn't bruise as much, because bruising is supposed to be day 4 or 5. Hello from day 4. Ice packing my face in the morning, and it's not even hitting my lids. Okay, whatever. I have a follow-up with my doctor later, and just to see how I'm doing, and after that I should be able to put water on my face, because it's been really hard to keep them out of being wet. So after this I'll be able to wash my face properly, and hopefully the bruising doesn't come, because it's day 4 and it's supposed to come day 5 to day 7. So let's see how it goes. I don't think I have any bruising so far. So good morning. Today is day 5 since my double eyelid surgery. It's looking pretty good. The swelling has gone down. It's to the point where you're kind of feeling that little like scab, like a cut, and it's healing. I'm really happy with the way that it turned out. It's just that little itch, a little bit of discomfort, but I wouldn't say that there's been any pain since the surgery. The most painful part is still the injections that was given before to numb the eyelids. I've been cleared to go back to the gym since my surgery, and I've been doing my outdoor walking and treadmill since the surgery, but no lifting or anything. But yesterday I had an appointment with my doctor, and I was cleared to go back to the gym. So at 50%, and then they're on 75, and then 100%. So I'm meeting my trainer later, and that's the update for day 5. I'm still taking the anti-inflammatory pills. It's not like antibiotics where you have to like finish it, but I feel that I should just take it to minimize any bruising or anything, but I don't think I have any bruising. Hello, it is day 6. I don't know how to count anymore. Friday till now it's Tuesday. And the swelling is going down a little bit, but I see a little bit of a yellowing. The bruising is coming, which is not ideal, but What can you do? But loving how it's looking right now, but the bruising is coming. This is me 1 week after the surgery. I just had a ice pack on. So the healing is pretty much there. There's still a little bit of swelling and a little bit of bruising, but other than that, it's pretty good. Feeling good, just a little bit of tightness when I close my eyes or when I stretch it out, but other than that, it feels good. I like the way it turned out. All right, so here's the final update for my eyes. It's been a month since my surgery, and I'm really happy with the results. It took maybe 3 weeks to fully kind of like settle down the swelling and the bruising. The left eye took a lot longer than the right eye, so it kind of looked a little bit uneven, and I was getting a little bit stressed and worried. But Dr. Ishan told me to just relax and let time do its thing, and now it's evened out. I'm really happy, and if you've been thinking about it, you should go check him out at Eagle Eye Aesthetics, and he'll take really good care of you. So thanks for watching.